Hi there, new IPs. I know they call you novice IPs, but I call you powerful IPs. You know why? You know, one thing I wish I was told when I started was that I didn't know what I knew. There were so many things I was so discombobulated about when I started. I thought I could do this job, but I can't do it. You know, I started 6 months into my job. I thought I just want to quit. Why did I become a hospital IP? It was so different from being an IP in public health, where I could just call other IPs and said, well, you have this patient with burkholderia, and this is what you need to do. Follow this step by step and everything will be fine, right? But when you're in the hospital, it's totally different because you have to ensure that you follow all the regulations and the policies. You have so many resources, sometimes you don't even know where to start, and people don't even know if they can trust you because sometimes they don't know who you are. And then when you start the job, you're like, okay, I think I should have just stayed where I was. I was a nurse first in the hospital at the bedside. I loved my job, but I knew I was going to go to public health. Then when I finally started working in public health, I missed the hospital. And I told myself, well, now I know how to work as a public health nurse. I know how to think on a population level. I can go back and bring that back to the hospital and help save patients. And of course I go back and I tell myself, why am I here? I was better in the office in public health, nobody knowing who I was. Now these people know my face and they don't like me because they think I'm the police. But you know, those first 6 months were really hard. But then I took some time and remembered why I started doing that, I became an IP, and then thought about my background, thought about the skills that I had, and realized I had so many transferable skills. And I had a team of IPs who had been doing that job for a long time. So those were my support. So use your support, use your resources, and you can use people like me who do consulting, who, you know, can coach you, who can help you, mentor you. So reach out if you need some help. If you need some advice, reach out. Trust me, I've been there. I know how it is. You can do it. All right. Happy New Year. I know it's the end of the year, the month of January, but in my country, in the Congo, we say Happy New Year until the very end of January. So Happy New Year, and I wish you a best year as an IP, as a new IP in your position. You can do it, and you can show everyone that you know what you're talking about. Okay, ciao.